Hi, I'm Dr. Vinod Methil, and in the next 5 to 6 minutes I'll be speaking on a very important and often neglected complication of diabetes, which we call it as diabetic feet. Now before I begin, let us look into some data why diabetic feet is important. So if you see, all over the world every 20 seconds a foot is lost due to diabetes. The risk of amputation in a diabetic patient is 25 times more than in a patient who does not have diabetes. And in India itself, if you look into data, there are about 40,000 amputations happening annually. So looking into this very dreadful data, now let us look into the three main aspects of diabetes foot. What exactly is diabetic foot? Can we do something to prevent it? And how do we manage diabetic foot? So what exactly is diabetic foot? It is something medically it's defined as any infection or any breakdown of tissue which happens in a patient who has got diabetes. Now in these diabetic patients there are also certain risk factors which actually can result in this infection, in this happening of diabetic foot. So when we have spoken about diabetic foot, now let us see what actually happens in a diabetic patient which lead to the development of this diabetic foot. Now, there are two important things which happens in a diabetic patient which can affect the feet. The first one, which we call as diabetic neuropathy, and the second one, which is called as diabetic vasculopathy or peripheral vascular disease. So let us take the first thing first. What is diabetic neuropathy? Now, as we know, in a diabetic patient, the blood sugars are on the higher side, and these sugars circulate throughout the body, and when they circulate in the feet, they slowly affect the nerves of your feet. So what is the impact of that? So when these nerves get affected, when these nerves get damaged, the feet starts becoming numb. It begins to start losing various sensations, the pain sensations, the heat sensations, the cold sensations, they start getting lost and the feet starts getting numb. And what is the impact of that? So for that we have to look into a normal person. Any normal person whose sensations are impact, these sensations are basically protective in nature. Means what? So when a normal person is walking, and if something sharp, some thorn, some nail comes under his feet, and when he keeps his foot over that, he can actually feel that. He gets a pain sensation, he immediately withdraws his feet, he will check his feet, and he will take remedial measures. But what will happen in a diabetic patient? The problem with the diabetic patients, since he doesn't have this protective sensation, so when he walks over any of such things like a nail or any sharp objects, he won't get that pain sensation. And the result of it is that he will walk over it, he will continue walking on that, and these foreign things can get embedded into his feet, and then it gets infected and leads to the various complications, gangrene and infection, all those things. Okay, so this is what happens with a diabetic patient who's got diabetic neuropathy, whose foot has become numb. Now, second important thing which happens in a diabetic patient is the blood vessels starts getting slowly blocked. So what is exactly that? I mean, we know that there are blood vessels which carry the blood. When these blood vessels in the heart gets blocked, we get an heart attack. Similarly, the foot vessels, when it starts getting blocked, the tissues which are supplied by this blood, they starts getting affected. Now, an important point to realize over is that any wound which develops anywhere in the body, it needs to get blood for that to heal, because it's through the blood only that all the oxygen, the nutrients, the medicines, antibiotics, everything reaches the site and helps that to heal. Now, if this doesn't happen, the wound is not going to heal. Now, this happens in a diabetic foot patient. The blood supply is compromised, the wound doesn't heal, slowly becomes gangrenous, and then ultimately the feet has to be amputated so as to save the life of the person. So these are the two important things which happens in a diabetic patient, which can lead to very serious complications, leads to the development of diabetic foot. Now the important thing is, the good news is that this can be prevented. So let me begin with some important tips which can actually help the patient to avoid getting any wound on his feet. Everything in diabetes is kind of preventable. So some important tips for keeping the feet safe. First and foremost, which I tell every patient of mine, is to never walk bare feet. Now, why is this important? This is very important because if you walk bare feet, you are exposing your feet to various forms of mechanical injury, which should be avoided. Now, this is more common in the rural areas where people are used to walking barefoot. People walk in the fields barefoot and start getting various injuries. So this can be avoided by actually wearing a footwear whenever you go outside. And to my patients, even I recommend them to wear some kind of floaters or some diabetic socks even inside the house, so that they don't get any injury. Second important point which I would say is that the footwear which the patient uses. The patient has to be very careful about choosing his footwear, especially if the patient is used to wearing shoes. He always need to check his shoes with his hand before putting it into his legs. Now, why do I say that? What happens is that if there is any nail or any pebble, something in the footwear, and if the patient directly puts in his feet, he is not going to feel anything. He will walk on that, and only in the evening when he removes his footwear, he will see that he has got a wound on his feet. So this also can be prevented by this simple process of checking his feet of his footwear with his hand before putting on the footwear. Third thing, which is again very common, is that use of hot water bags and ice packs on the feet. Now, what happens in a diabetic patient is that because of the neuropathy, the patient gets pain in their legs. They gets a burning sensation in their legs, and to get relief of these feelings, what they do is that they use either some hot fermentation or some ice packs on the legs. They keep their feet in hot water, or they use hot water bags. Now again, important point to remember here is that the feet is numb. They are not going to feel the temperature. And I've seen so many patients coming into my clinic with blisters which have been formed because they have kept the hot water bag on their feet for some 15-20 minutes without actually feeling the temperature, knowing the temperature, and they get a blister. They see a blister on the next day, and then the whole process sets in: the blister, the wound, and infection, all those things. Again, this can be avoided by not doing any of these things. Then diabetic patients, the nail cutting, again that's a problematic part for diabetic patients because the nails become very thick and becomes difficult to cut. But I always advise my patients to cut their nails in a straight line. Just file the edges to make it blunt. Do not go any deep while cutting your nails so as to avoid any injury. The patient should not do any self-surgeries, any cutting on their feet without the advice of a doctor. The next important thing is getting a proper footwear for the patient. The footwear should be such that it should not be too tight, it should be broad in the front, not narrow, and it should not have too much of heels, and it should have good proper insoles inside. Preferably, I advise my patients to buy their footwear in the evening, because there's a slight increase in the size of the feet in the evening. Okay, so they can buy it in the evening, and whenever they get a new footwear, they should use it slowly so that they don't get any shoe bites. These are some simple tips which I can advise my patients so that they do not get any unwanted injuries which can further lead to complications. Now finally coming to the treatment part. Treatment part is a bit difficult. It's very important that the patient always inspect his feet regularly, and if we find any wound, anything in this, any even small wound in the feet should not be neglected, because they might appear very small from outside, but actually it goes very deep inside. And they have to show their feet to a proper doctor, a doctor who is quite conversant in handling this patient in this diabetic fit, so that he can take an appropriate remedial measures to prevent it from worsening, deteriorating and going bad. So proper dressing, proper care can actually help in healing the patient, healing the wound of the patient. In Sweet Clinics, we also have started PRP therapy for diabetic foot cases. I mean, PRP is basically platelet-rich plasma therapy, and it's a very simple procedure which actually promotes faster healing of wounds in diabetic patients, in diabetic foot cases. So that is all the advice I can give for you now. So if you are diabetic patients, do not forget to keep your blood sugars under control. Take your medicines properly. Consult your doctor regularly and stay healthy. Thank you.